After assessing the heart, we will now go to the assessment of the neck vessels. So first, we will make sure that the patient is sitting is in the position appropriate for checking for the neck vessels. So first, we'll ask the patient to be in a sitting position. Then later on, we'll ask the patient to be in a semi-fowler position for checking for the jugular vein distension. Then after checking and asking the patient to be in a sitting position, we will now check the carotid artery for visible arterial pulsations. So tanong na mo sir ha. Okay, so there is no visible arterial pulsation. So now I'll palpate the carotid artery to check for rhythm, strength, and elasticity. So ako feel akong emulyo sir ha. Nagkapan sir ha. Okay, so the carotid artery is found between the trachea and the sternocleidomastoid muscle. So I'll note the rate. I-raise itong chin kami sir. Okay, so under in a minute, the carotid artery has a pulse rate of 79 beats per minute, and its strength was similar to the radial pulse, and its elasticity and the pulse was elastic. It was able to rebound the pulse rate, and for reading its strength, I will give it a 3. The pulse was easily located, and the pulsation was felt even without great push. So now we will auscultate the carotid artery for any blowing sound which could indicate a bruit. So we'll use a bell for it. So hindi ka, ito na kasi mong liog sir kay pwede ka maginhawan i-hold yung breath. Okay. I-extend ka ito liog sir. Okay. Hold the breath, inhale, hold. Okay. Okay. So upon auscultating, there were no blowing sounds heard which could indicate a breath, so the patient has no breath on his carotid artery. So the last part of the physical assessment of the neck vessels is the checking for jugular vein distension. In this test, we'll ask the patient to be in a semi-fowler position, which is in an angle of less than 45 degrees, and we will note for any bulging of the jugular vein. So in this test, we'll ask the patient to look to one side and notice and observe the jugular vein. So sir, ako check yung jugular vein sir ha. Yung vein niya sa mali. O pwede ka muling ito na side sir. Muulo no? Okay. Okay, so the jugular vein is not visible, which indicates that there is no jugular vein distension. Which, if you have a jugular vein distension, it can bulge or be in a curve form. So now I'll check for the other side. This are linked side, sir. Okay, similar to the other side, it has also no jugular vein distension. After checking for the neck vessels, we'll now proceed to checking for the peripheral vascular assessment. So first, we will note any changes in color skin condition in the patient when sitting and compared to when standing. So in the sitting position, I do not observe any cyanosis or pallor. So we will now ask for the patient to stand. So pwede ka mabarog, sir? Okay, so upon standing, there is no changes also. So there is still no cyanosis nor pallor observed. We will now proceed to the palpation of the edematous areas such as the feet, ankles, and leg. And in these areas, we'll also check for pitting edema. So first, we'll do the calves. So this area is prone to edema. So using our thumb, we will check for pitting edema. Okay. So both calves were able to retract. There is no pitting edema observed. So we'll now proceed to checking for the ankles. Sir, pwede ka mo kuhan, sir? Nang change position mo kuhan. This one. So we're going to check for the ankles. Okay. There is also no pitting. The skin was able to retract upon the compression of the pressure. So lastly, we'll check for the feet. Okay, so the feet was also able to retract upon the compression of the pressure. So no pitting edema was observed in the patient. So after checking for the pitting edema, we will now check for capillary refill. So sir, pwede ka man na sir. Niya ako ano mo po kamay ha. Release ng pressure na kayo observe. Sige sir. So upon release of the pressure, the capillary was able to refill with blood with less than 2 seconds. So now we'll also observe for phlebitis. So in this part, we'll note for any redness, inflammation, or warmth of the patient's skin. Yun yung ipapasok kayo, sir. Ito naman ako, sir. Okay, so no phlebitis was observed in a patient. So now we'll check for the pulses. So first, we'll observe the radial pulse for rhythm, for rate and rhythm. So pwede naman yan ang gamot, sir. Ano ako sa left side? Okay, so your radial pulse on your right side is 77 beats per minute. So now I'll check for the radial pulse on the left side. Okay, so the radial pulse on the left side is also 77 beats per minute. So now I'll check for the ulnar pulse. So, ano ako sa right side, sir? Okay. Sige po sir, ako siya i-count din, sir. Okay, so your ulnar pulse on the right side is 78 beats per minute. So now sir, I'll check for your ulnar pulse on the left side. So, on the left side lang sir. Okay, so your ulnar pulse on the left side sir is 77 beats per minute. So na sir, kay ako sa kong ng pulse dili sa anong dili sa musik ko. So una ko sa akin sir sa right side sir. So, ano ikaw na lang sir. Okay. Okay, so imong right vertical pulse is 76 beats per minute. So para sir, sa imo na sa akong sir, sa imong left side sir. Ikaw na lang sir. Yes, imong left side sir kay 79 beats per minute imong vertical pulse. So we'll now proceed to the kanang pulse imong PL sir. Lastly, we'll check for the dorsalis pedis pulse, and in this, we'll ask the patient to be in a lying position to be able to check for the pulse. So I'll start with the right dorsalis pedis first. Okay, so the right dorsal pedis in under a minute has a pulse rate of 78 beats per minute. So we'll now check for the left side. Okay. Okay, in under a minute, the left side has 74 beats per minute. And all the pulses, the ulnar, radial, brachial, dorsal pedis have a even rhythm, and their pulse grade would be at 3. Their pulses are easily located due to their strong position, but not strong enough to be considered as a 4. So now we compare the findings with the normal assessment. So based on his assessment, there is no visible pulsations nor exaggerated dips on the chest area, and no extra heart sounds are heard on the heart. And when it comes to the neck vessels, there is no visible arterial pulsation, no blowing sounds were heard, and there is no jugular vein distension. When it comes to the peripheral vascular assessment, there is no cyanosis, no pallor observed, and the patient has no edema nor phlebitis. And the patient's pulse rate and heart rate is within the 60 to 100 normal range. And the reading for all the pulses is a plus 3. So these are all normal range, which indicates that patient has no problems or health problems with his cardiovascular system. So this ends our assessment for the cardiovascular system.